Albany, governor's coming in the room. Roll your records.
Packets? Did we distribute the packets? Thank you very much for coming. I think that we on the government side and you in the media are at a point in time where we can use one another. It might not be too much to say where we need one another, and I think the public needs us both more. We have said a lot, and a lot has been written and said by others about AIDS. But I think you'll agree, those of you who have been paying some attention to it, that many people remain uninformed, and drastically so. I mean, that's my experience every day. It was yesterday with a group of college students out on Long Island, and it is everywhere I go. Too many people continue to put themselves at risk because they're unaware that their behavior may conceivably lead to their deaths, and too many others see risks that don't exist. So we have taken an active role in the dissemination of information about AIDS. We were, as you probably know, I think the first state to allocate funds for AIDS research in the United States. 28 two-year research grants. We spent over $5.1 million were awarded in 1984, and this year there's an additional $2.7 million that has been appropriated for AIDS research. And the Health Department has sponsored a comprehensive statewide educational program that's been directed primarily at those who are at risk of acquiring AIDS and at the occupational groups that come in contact with the victims of the disease. And the department has done what is fair to describe as extensive educational work in the gay community. And while the actual number of reported AIDS cases in this community continues to climb, I think if you look closely at those numbers, you'll see a reduction in the rate of the increase. And we think that education has been the key to that reduction in the rate of increase. We also believe that the efforts of the state government and the media have made a worthwhile contribution to date, but that now we have to do much more until the scientists find a cure for AIDS. And we're told by the federal government that that won't be until after 1990. I think the last date they used was 91 or 92, and of course they're only projecting. But until scientists find a cure for AIDS, education will be our only vaccine. In my direction, the State Health Department has compiled a list of 100 questions and answers about AIDS. The booklet contains what we think is the very best, the most up-to-date information that we have on AIDS, and I think it's the first document of its kind compiled by a state for distribution to its people. I suspect that we'll see more of this. I think we should. This document covers every major facet of the subject of concern to the general public, all in one book. It will allay some fears, I think, but it does more than that. An extremely important segment of the booklet tells people how to reduce the risk of AIDS. And we face some very, very hard truths today. It's true that despite massive publicity about AIDS already, many people remain ignorant of the facts that we have available to us about the disease. It's true that though the material we offer today is probably one of the most comprehensive documents that's been published, it says nothing that hasn't already been said in a wide variety of documents and publications that came before. It's also true that while the state has done extensive educational work within the so-called risk groups, until today, most of government's efforts with the general public have been aimed at allaying their fears. Now that message, the need for calm, the need to avoid irrationality and panic, that message is, of course, essential. It should not, however, be interpreted as an invitation to complacency, because that would be wrong too. Beginning today, we'll put a whole new emphasis on what people should do to protect themselves against this disease. And beginning today, we'll ask everyone with the capacity to do so, in government and outside of government, in the media and outside of the media, to help us to disseminate the information that we'll make available, to help us to get the message out that AIDS is caused by blood-to-blood and semen-to-blood contact. AIDS is passed from blood to blood or from semen to blood, and that all sexually active people, whether they're homosexual or heterosexual, should refrain from sexual contact with people whose health and history and health status are unknown to them. That people should avoid anonymous, promiscuous, sexual contact, because if they do that, they risk AIDS. Blood to blood, semen to blood, all sexually active people, whether they're homosexual or heterosexual, should refrain from sexual contact with people whose history and health status are unknown. People should avoid anonymous, promiscuous, sexual contact. Not because it's immoral, people make their own judgments on that. We're not dealing with morality. We're dealing with a health hazard and with a behavior that we know threatens people. It threatens their health, threatens their lives, and is therefore a threat to the whole community. We need help to get out another message to intravenous drug users. IV drug users must now know that if heroin, cocaine, and other injectable drugs don't kill them, then maybe AIDS will. And there are other steps we're taking to deal with the problem. We're working cooperatively with New York City to make beds available at Metropolitan Hospital for prisoners with AIDS. It's a larger problem in that concentrated population than it is in the general population, and we need to make special arrangements for them. We're working hard and have been to make some beds available in Metropolitan Hospital, and I think we'll have those available sometime in the summer. Tom Coughlin, Larry Kurlander are all available to answer questions on that subject in a few minutes. Now, we know that certain sexual behavior can lead to AIDS, which can be fatal. And we think we ought to eliminate that activity as much as possible where it's involved with public establishments which profit from the activities that foster this deadly disease. And so tomorrow morning, Dr. Axelrod will ask the Public Health Council to adopt an emergency amendment to the state sanitary code that prohibits these activities, and he has my full support. You'll recall that Dr. Axelrod reviewed this subject in 1983, the subject of establishments that promote, encourage, support, allow promiscuous sexual activity of various sorts. And upon a review, Dr. Axelrod's report said, in effect, please don't hold me to the precise verbiage, but in effect he said that he thought that while there was some risk, we could use these establishments to educate the people who were at risk, and so instead of moving against the activity legally or seeking to close down the establishments, if that were possible constitutionally, we ought to use them in July of '83 to educate the population that patronized the places, and we've done that. But now another review and the benefit of all that we've learned since then has induced Dr. Axelrod to report to me that he believes it is a health hazard and one of sufficient dimensions so that we ought to do what we can to prohibit certain types of sexual activities that are plainly, as a matter of evidence, plainly have a nexus with AIDS and are therefore a threat to the whole community. Dr. Axelrod has recommended to me in a letter, which I assume will be available, has recommended to me that he go before the Public Health Council tomorrow and seek to adopt a regulation, it can be done by regulation, seek to adopt a regulation that would prohibit that activity, find people who run establishments that promote or allow it. The exact language is going to be a difficult chore. Dr. Axelrod has his lawyers working on that now, and that language will be submitted to the Public Health Council tomorrow. He has my full support. I concur with his report because it was produced by Dr. Axelrod, in whom I have, as I think I should, enormous confidence, but also because of the palpable, self-evident logic and persuasiveness of his conclusions. Upon adoption of this amendment, if that's what occurs, and if the council agrees with him, New York City and other local governments will work with us to regulate those places which pose this special public health risk. And establishments that violate this new regulation will be subject to fine and will be subject to being closed by operation of law. There's nothing unusual about this. You can close a kitchen, a public kitchen. You can close a restaurant. You can close a grocery store that sells meat inappropriately because it doesn't refrigerate it properly. We have a vast public health jurisdiction that we use every day of the year and use it very effectively. And certainly, if we have the capacity legally and practically to deal with those lesser health risks, we ought to be able, through the the Commissioner of Health and the existing sanitary code as amended, we ought to be able to deal with something which all the experts concede is a serious threat to life. And so we're hoping that the Health Council tomorrow will agree with Dr. Axelrod, and you, of course, will be able to question Dr. Axelrod in a couple of minutes. Finally, I've instructed Dr. Axelrod to formalize his contacts with health commissioners throughout the nation to ensure that we receive and that they receive in return the most up-to-date knowledge and information as it becomes available. And we want all of us to be current and all of us to share in this information. California, Florida, New York State, all the places where experience is developing. It seems silly to fragment the effort and do it independently when just a little intercommunication will allow us all to profit from one another's experiences, as, for example, we profit from what was tried in California on the subject of bathhouses. And Dr. Axelrod is a natural person to lead in that effort, and he's been doing it already informally. He will formalize that effort to tie together the various states that are interested. We're not going to create a whole new bureaucracy. It's just a matter of doing what is apparently intelligent. We'll establish a number of AIDS primary care centers in New York City. These centers will organize treatment and care service packages for AIDS patients. They'll provide primary care, social services, and contracting for additional services, including inpatient and hospice care. We'll also be putting more money into research. Federal government announced yesterday that it will be putting money into research, and that's good. We've assembled a team of experts to work with the people of the state and to work with you. We have all of them, I think, here today. Dr. Axelrod, of course, is here. Julio Martinez is here. Cesar Perales, the Commissioner of the Department of Social Services. Tom Coughlin is standing behind me. Tom Hartnett and Larry Kurlander. All of us are at your service in this effort and at the service of the people of the state, and we look forward to working together. Questions?
Governor, where's the money going to come from for the additional state funds?
What, for what?
You're pumping more money into this. Where's the money going to come from?
Some of the pot. I mean, there's a limited supply. So obviously, when you put money here, it comes from somewhere else. We don't know how much. We don't know exactly where it will come from because I haven't made the budget yet. But what we'll do is put all the pieces on the table and we'll assign priorities, as always we must. You recall the first year we had a $1.8 billion potential deficit. And if you had asked in the beginning of that year, well, Governor, you're going to have an AIDS problem that you don't know about right now. Where will you get the $5 million? You would have said, I don't know. And you don't. Well, then where do you get it? You press down somewhere. Rodriguez loses $1 million. Martinez loses 300,000, you know, and unless they do the right thing, right?
How are you going to be able to police the bathhouses, if you will, to know whether or not these activities are going
My
on?
father's grocery store.
You've got enough men power to be able to go out there?
You've got to do what you have to do, obviously. I mean, this kills people. You take from somewhere else and you put your resources here. And if they adopt a regulation, we'll get it enforced. Excuse me.
Are you expecting they to be closing these down pretty much in succession?
I don't know. First, they have to adopt the regulation. Then you have to see what happens when the regulation is adopted. Maybe people will take it seriously and won't do this. Maybe when you tell people on television, as I hope you will, that the reason the state is considering this is you can die from this, and they're not kidding, maybe people will say, hey, maybe we'll find another place to go and another thing to do. Now, there's some evidence that that has happened to some extent. There is a modification in behavior habits. Difficult to measure precisely how much, but some of that has occurred. And so, you know, it may be that a lot of this will stop. I certainly hope so. I still think that education is the most effective instrument here. And if it doesn't, I don't know how many of these establishments there are. I don't think there are a whole lot. And I get the general feeling from all the information that's come flooding into me, including affidavits from people, that the establishments that are most likely to be the subject of this kind of regulation are already well known, easily discernible, and easily investigated. Also, we've done some investigating already. Dr. Axelrod did. He had to before he could recommend to me intelligently. He had to know what the activity was. He had to know what evidence there is that it's hurting people, and he's been through that. That's one of the reasons why this took a little time to do, because he had to build up that evidentiary base. Fred, I'm sorry, Fred.
Thank you, Governor. I'm a little confused by the analogy between health inspections at restaurants or stores and checking these bathhouses. I don't understand how, and it's a question, how can an inspector determine whether or not human beings are participating in an activity that's prohibited and compare that to looking to see if meat is spoiled or if there are cockroaches?
I would recommend to you that you drop the analogy. You're right, it's not a good one.
Well, then, let me ask you this. Apparently, under these proposed regulations, anal intercourse with a condom would be permitted.
No, who said so?
Well, okay, would it not be that?
Oh, I don't know. He hasn't written the language yet.
Well, because you're talking about semen to blood contact.
Yes.
The question I'm getting to, it seems to me certain types of sexual practices.
Just slow down and let's make sure we know what the question is, because so far you've come with two that you've withdrawn.
Let me rephrase it. Under the proposed regulations, it would seem that some kinds of sexual practices could go on, which would be considered safe sexual practices.
I don't like the term safe sex. I don't use it. I know various task force has. I'm not promoting safe sex.
Would any kind of sexual practice...
Let's get this clear. The state is not promoting safe sex. We're not promoting any kind of sex. That's not our business. We are going to fight unsafe sex. You know, let's not get... I don't want to see posters going up say, Cuomo says do safe sex. I mean,
Governor, would any type of sexual practices, do you believe, be permitted under these proposed regulations for the
we're going to have a serious population problem.
In the bathhouses?
The,
Because I'm wondering if any kind would be permitted, as I understand my reading of your material would suggest that it would be, then how are you going to have an enforcement mechanism to see that safe sex is going on? But
I think these are all intelligent questions. I think they're exactly the questions the Public Health Council will be asking itself tomorrow. They'll get the exact language. They'll say, what does this apply to? How are we going to do it? That's what tomorrow is all about. I'm confident that we can write the language and enforce it. Blood to blood, semen to blood is the key, you're right. And it doesn't get too complicated after that. How do you move semen to blood? Does a condom stop it? No. No, that's why all the condom manufacturers tell you this isn't fail-safe, don't sue me. You know, so it doesn't, it may slow it down. It may be an imperfect contraceptive, but it's not perfect, as we all know.
Governor, are you and Dr. Axelrod convinced that these regulations would eliminate the
No.
risk of spreading
No,
AIDS
no.
in the bathhouses?
No,
Then why are
absolutely
you
not.
leaving the bathhouses open? Why not
Oh,
close them?
hey, we have rules against minors drinking. That doesn't eliminate it. I don't know of any rule that we've passed that eliminates the activity we're prescribing. I mean, if that were the test, Mickey, I would get rid of practically. We have rules against murder. Doesn't stop it. We have rules against tax cheating, and we had to
You don't
declare
have
an
places where
amnesty.
people can commit sort of murder. Did you consider at least closing these places up?
Mickey, we have all kinds of rules for taverns. Does it stop all the illegal activity in taverns? We have all kinds of rules for restaurants. The health department has regulation upon regulation for restaurants. You have to wash your hands after you go to the boys' room. Does it prevent people from ignoring? Of course not. What's so unusual about using the same approach to something that could kill you? If you're saying, will this end it? Of course not. If you're saying, is it the most important thing you can do? I don't know. I think education is the most important thing you can do, and I think this certainly helps with the education. Because now this is government delivering a very clear message, is it not? That we believe this activity can kill. Now, how do you say to the population, how do you say to your children, we believe that this activity can kill? And then when your children say, but do you allow them to do it? Oh, yeah, why? Because we couldn't stop it anyway. I mean, do you really think that makes sense? I don't.
Pardon me, but that seems to me like exactly what you're doing. Did you consider closing the places up?
Excuse me?
Did you consider closing them?
Dr. Axelrod did, and reports, as he will fill in for you in a moment, that they tried it in California to write a rule, or for the governor to say, all bathhouses close. What about a bathhouse that gives baths and doesn't do anything else? And the guy says, I'm a Russian bathhouse. We have a lot of Russians who come here and take baths. They don't do anything else. How do you close that place? Just because it's called bathhouse? Now, if you say in every bathhouse they do it, you have to prove that. What if a guy steps forward and says, I have a bathhouse? Believe it or not, people come here for baths.
But these places, which
That's what
are
happened,
not-
incidentally, in the lawsuit,
You
Mickey.
did-
They
you-
tried it. They tried it in
And you
California.
found it impractical, in other words.
No, they found it illegal.
And that's the judgment why you didn't do it.
Oh, no. I didn't recommend it. Whether that's the whole reason why he recommended what he did, you can ask David, and he'll tell you in a minute.
Yeah,
But
okay.
I don't think we should make this simplistic. You know, there are a lot of reasons. If you suggest closing all bathhouses, think about it. What would the law say? All bathhouses must close. What's a bathhouse? Well, then now you'd have to define it. Well, a bathhouse, we don't mean a bathhouse where you give baths. That's silly. We mean a bathhouse where there is the following kind of sexual activity. Describe it. Okay, but then what you're doing is really, you're going after the activity. That's right. Well, that's what he's recommending. Let's describe the activity, and instead of describing the place, let's go after the activity. If you do it in a bookie joint, you know, then it's illegal. Why should you limit it to bathhouses? If that activity is what you're after, why should you be talking about bathhouses or private clubs or the back rooms of taverns? Go after the activity. That sounds perfectly intelligent to me.
Going after the activity or only the activity in certain places? Would it apply to houses of prostitution, for instance? These rules, they got to post
I'd have to see the
things?
exact language of it, but the import of what Dr. Axelrod has recommended to me, as I understand it and therefore approve of it, is a place, for want of a better word, that would promote, encourage, and support this activity on a kind of institutional basis.
Including the house of prostitution.
Well, I don't know what houses of prostitution are. If they, you know, if that's a place where they do this blood-to-blood, semen-to-blood, then, see, semen-to-blood, well, it's, Mickey, it's tough, but semen-to-blood, you know, there's a certain kind of intercourse that's more likely to produce semen-to-blood. The traditional modes are not likely to produce that. There are, I'm not even sure the word traditional is right anymore, you know, this is tough. Axelrod will tell you, yeah.
As to the scope of this amendment to the sanitary code, it would appear from my reading of the press releases and things that you put out that it not only would apply to gay bathhouses, but it would apply to places that allow on-site sex, and that it also might apply
You have to slow down, because
To-
I have a definitional problem. A place that what?
that allows, like bars, that allow on-site sex, as well as, it would appear that it would also apply to heterosexual.
There are such places, you're
Yes,
telling me?
in New York City, there are many.
There are
places.
many.
Yes. We've gotten a lot of calls about that, actually. It would appear that it would apply to those places, as well as places that have
I-
heterosexual and homosexual
Marcia, I think it's
sex
probably a
going on.
mistake. You'll do obviously what you want. I want to see what the Public Health Council does tomorrow. They're going to ask all these questions. They may develop their own kind of language tomorrow. I don't know. I'll tell you what my intent is and what I support in Dr. Axelrod's recommendation. Proscribing the activity and places that promote, support, and encourage it. Now, Beyond that, I'm going to leave it to the Public Health Council.
What activity? Is it activity that involves gay sex, or is it activity that involves promiscuous
It
sex?
is the kind of intercourse and sexual activity that is likely to allow semen to pass into blood or blood to blood, thereby increasing the possibility of transmitting AIDS.
But does it involve men and women, men and men?
It can involve almost anybody. The evidence indicates that it's less likely to occur in a traditional heterosexual coupling, but the evidence does not exclude that.
So therefore, will places that allow heterosexual sex to
I don't
go
know.
on
I think you're getting
fall
too
under-
exquisite for me. I'll wait for the Public Health Council. Yes.
I've got two questions. As part of these regulations, are you going to do what San Francisco did and require cubicles and bathhouses to remove their doors? And second of all, you're going to...
I don't know. We'll wait for the Public Health Council. They're going to work on that language all day today.
And second of all, it's the same kind of question, places that have like darkened areas. Are you
We'll
going
wait for the Public Health Council.
Well, Governor, absent the amendments to the sanitary code, could someone explain, Mr. Kurlander, perhaps, at what point encouragement of any kind of sex by an establishment becomes illegal?
No, you can't until you see the regulation.
Well, no, I'm saying under present law, under present
I don't-
regulations.
we don't-
At what point
I don't know of any law that says you can't encourage sex.
on the premises?
I don't think, we have any law like that.
There is no law that would
That
be
says you can't
applicable to a
encourage
house
sex?
of prostitution.
Oh, well, that's different. That's not, house of prostitution is something else, but not encouraging, sex is a beautiful thing. I mean, if you say we had a law that says you can't encourage sex, that's like saying you shouldn't promote marriage. So we don't have a law that discourages sex or says you can't encourage sex. There are certain kinds of illegal conduct, like selling sex, and we have laws like that. Sure, every society I'm aware of, well, most societies have had laws against prostitution. We have that.
Well, there is nothing then that merely makes it, makes it illegal for an establishment to make it convenient to have sex between,
I'm not aware of that language. I don't think we have any law like that. You know anything about a law that says you can't make it convenient?
There are only 3 prescriptions that I'm aware of. Age, that you cannot, an establishment cannot promote sex with the children, the sale of sex, the governor mentioned, and force.
Well-
There are statutes that are prescribed.
Well, age is a good one. Age is a good one, David. I mean, that's a place where even a single act is illegal. That is a place where the law has said we regard it as a violation of whatever code we adopt by consensus. I don't want to call it morality, but we regard it as unreasonable for you to have sex with people under a certain age because we don't think they can consent intelligently. That's one place.
Governor, isn't there another constitutional problem? That is that you'd be discriminating against the gay population when consenting adults, be they 2 men who might have AIDS or may not, they have a right to engage in sex however they may choose to do so? Might they not sue you?
It's not, the rationale here is not privacy of the conduct, but the threat it poses to the whole community. The threat goes beyond you. It passes from you to the next person.
But if they're doing it, whether it be in their private apartments or in a public place, couldn't they take a class action suit as a group and say, you
Oh,
can't
they
stop
probably
this?
will. And then that's the question society has to decide. And it gets complex legally. If, for example, you tried to do it in a single episode, I mean, to go from one extreme to the other, let's say you took a private home, and you say, here's a couple, in the privacy of their own domain, in a monogamous relationship, doing this regularly. Could it be a threat? Probably. Would you try to condemn that? No. Why? Because, once you get into private settings, et cetera, we have that whole law of privacy. Now, here's a place that encourages people to come off the street anonymously and do it promiscuously. How about that? How about a person who pays his wife for sex? Not unheard of. There are lawsuits like that. She's reluctant to do it unless you give her a diamond ring. And they're married. Is that prostitution? Are you kidding? Who's going to make a law on that? We wouldn't try, right? But have a house where you come in and it's for sale, large, medium, that's illegal. These are, look, let's make it clear, okay? This isn't going to solve our problem. It's not the easiest thing to regulate. It's not the easiest thing to do. The alternatives as we see them, as Dr. Axelrod sees them, is, look, we can stay away from this whole subject and say, let's just try to talk them into it. That's what he said in July of '83, and it made sense to me. And I said, good, let's try. And now there has been some improvement, but I don't think there has been enough. I get people calling me on radio shows. I get gay people calling me, non-gay people calling me. And I'm convinced that it's important for government to say, hey, look, don't kid yourself. See, I'm getting the feeling that because we haven't done anything, some people are out there saying, how bad could it be? Now, let's be honest. How bad could it be if they continue to let us do it? I mean, think of it that way psychologically. Well, how can you say, Governor, what's in their minds? I can't. All I can do is guess. And I'm saying that that's a rational speculation, that maybe they're being misled by our not doing anything. So, and where do you draw the lines? Of course you're right. Where do you draw the 21-year-old purchase age line? Why should you be a certain age to get married? We're constantly drawing difficult lines in this society. And we could argue forever as to why you put it there and not here. Why this precise kind of activity and not that. You know, and so it's not going to be easy to deal with. Dr. Axelrod feels we should try. I agree with him. I support him fully. And we're going to try at the Public Health Council. They might not allow us to do it. Lisa and then Mickey.
Governor, I see that you have somebody here from corrections and from state
Yes.
employees. What kind of provisions is this policy going to have for caring for AIDS victims within the prisons and also state employees who may be AIDS victims?
Well, in the prisons, the Metropolitan Hospital unit will be available this summer, and that's, I think, going to be 22 beds.
The whole statewide prison population?
Yeah, there's
or-
over, what, 150? How many do we have, Tom?
We have about 40 confirmed AIDS patients right now, and another 40 or so with age-related complex. The 22 beds that we're opening at Metropolitan Hospital, and by the way, there's a piece in the package that talks about criminal justice. The 22 beds at Metropolitan Hospital will handle the acute care needs of the state prison population. We have another backup to that of probably another 10 or so beds at Westchester County Medical Center, which we're using right now. And the purpose of Metropolitan Hospital Unit was to get all of the people that we have confirmed as AIDS come from the city of New York. And just on humanitarian grounds, we want them back in the city if they require that acute care hospital.
Well, now, Tom, they're all from the city, but they're not close to the city where they are now.
That's correct.
So you're moving them down to where they can be visited.
We have them in hospitals, Erie County Medical Center, several hospitals upstate, Champlain Valley Hospital, Horton Hospital, and there's one or two here and there. We feel it's more appropriate to get them in one spot, train one set of staff, get one set of medical procedures so that we can be consistent in treating the acute needs of these inmates.
Lisa, your other question, as I understood it, is public employees. Now, I think there's a suggestion in that the public employees are especially vulnerable, and I don't think that's true, David.
No, there is nothing to suggest that public employees, however they may be employed, represent a specific class that needs to be dealt with in any special way.
Even the ones in the hospitals, et cetera, all the orderlies, et cetera, there's no evidence of that. I think that's in the Q&As.
But is there any, do you feel in the prisons, I mean, some of the prison guard associations have been very worried about AIDS and contracting AIDS, and they may have unfounded fears. Do you consider it medically necessary to segregate AIDS victims within the prison
No, that's
population?
in the Q&A, and the answer is very clear in the Q&A. Now, remember, they have two groups, at least, I guess, in the prisons, who are in the high-risk category, the two major ones, including IV users. With IV, as Julio knows well, we seem to have a bigger education problem with the IV users. Now, I don't know whether the compulsion, the addiction is so powerful that even the fear of AIDS isn't enough to deter people, or it's a question of not getting the message to them. But no, there is no special proposal for public employees. Mickey.
Governor, could we ask Dr. Axelrod why he didn't recommend that the things be closed up?
I'm sorry.
The
question-
bathhouses, why do you recommend leaving them open?
It's not a question of bathhouses. I think the governor's made it very clear that we have a public health problem, and the public health problem relates to certain kinds of behavior that we have defined as high-risk behavior. And therefore, it's not a bathhouse issue. It's those places that encourage high-risk sex that result in blood-to-blood or semen-to-blood contact. And it is clear it is not bathhouses alone. There have been several questions here that have alluded to other locations where the same kind of activity takes place. We're addressing the behavior, regardless of who it is that's responsible for that behavior.
Who's going to have to post these regular, give out condoms and et cetera, et cetera? Who's going to have to do that? Bathhouses and who else?
The responsibility for the enforcement of the sanitary code is the responsibility of the Commissioner of Health, who then exercises it through local commissioners of health where there are organized counties. Where there are no organized counties, that responsibility falls to the Department of Health directly. But the responsibility for the enforcement of the sanitary code is the responsibility of the locality.
Who is this going to be enforced upon? We've got 8 or 10 bathhouses in New York. That's it?
I think that that's a conclusion you've drawn, not me. Well, I think that from what has been, the questions that have been asked here already suggest that there are other establishments that encourage the same kind of high-risk behavior. I think you have to remember that this is not a real estate program. It doesn't relate to location. It relates to public health risks associated with certain kinds of sexual behavior. And I think you've got to stop talking about bathhouses.
It's the other establishments that you're talking about.
But there are...
Excuse me, let's stay with Mickey. Go ahead.
I'm sorry, well, no, I mean, exactly, it's the same question. Everybody knows there are houses of prostitution. They are illegal. You're going to now start monitoring them for a certain kind of activity?
No, the house of prostitution isn't illegal. The prostitution is illegal, and that's the difference.
Well, what are you going to do?
You see, the activity is illegal. Let's take your question. Why, doctor, didn't you prohibit bathhouses? You couldn't do it, Mickey, unless you defined a bathhouse. And the only way to define the bathhouse is by defining the activity. Therefore, it's much more intelligent to prohibit the activity. You're not prohibiting bathhouses. What if you had a bathhouse where they didn't have blood-to-blood, semen-to-semen possibilities? What if you had a traditional heterosexual bathhouse for shy people or couples who were married, who liked to go to a bathhouse? You can't condemn the bathhouse without reference to the activity. Once you describe the activity, you condemn the activity wherever it is. They tried.
You're going to police the activity wherever it is.
The only people I know who are in favor of closing the bathhouses are editorial boards, who say, let's close the bathhouse, it sounds great, but doesn't make sense, which isn't the first time. Yeah.
Now, Joshua, do you expect that the end result of this emergency amendment to the sanitary code will be that a number of these places will close down of their own?
I can't hypothesize as to what will happen. I think you can look at the experience in San Francisco as to what transpired as a result of the regulatory process there. I think you're aware of the fact that a number of those bathhouses, as well as other venues, did close down as a result of the enforcement of the regulatory process.
Yeah, and you see, if you make a regulation that deals with this activity, and I'm not sure he's going to be able to do it, but if he's able to do that with the Health Council, and you'd investigate, let's say, the places where Mickey names 8 or 10. I mean, everybody seems to know that there are places out there. Well, then, naturally, they'd be the first places, I guess, you'd go and investigate. And if you started doing that, maybe they'd open places that weren't called bathhouses. Maybe they'd move into different kinds of environments. Maybe they'd open sports clubs, weightlifting clubs, or maybe they'd open social clubs. So it wouldn't be a question of going to bathhouses or any particular establishment. You'd follow that activity wherever it went.
Okay. Actually, could you identify...
There was somebody here, excuse me. Yes, Jeff, I think. Did you have a question?
Well, yeah, I guess we know that this activity occurs in some bathhouses. We know that this activity occurs in some houses of prostitution, in the back rooms of some bars, not only in New York City, but other cities around the state. And these will be the places, then, that are going to have to post these posters, set aside condoms, everything like that. And again, where this activity occurs.
Well, wait a minute. I think what you're doing is you're interpreting something from the letter that I wrote to the governor that is not, that is not necessarily the that I'm making to the Public Health Council. What you are looking...
That was the task force regulation.
The point that I was making in my recommendation to the governor was that the AIDS task force, the AIDS Advisory Committee, which is advisory to the Commissioner of Health and is established in statute, itself recognized the need to make mandatory certain provisions that previously had been voluntary. And the point that I was making is that none of these provisions really relate to our ability to deal with a very specific issue the governor has addressed, the blood-to-blood, semen-to-blood contact. And therefore, something else needs to be done that we would hope would be done through the regulation that we will address to the Public Health Council. Now, whether or not all of these things become part of the educational activity is something else. We have been engaged in those kinds of educational activities. We would propose that those kinds of educational activities continue. On the other hand, I would not suggest to you that the recommendations to the Public Health Council would be limited to the kinds of things that were recommended by the AIDS Advisory Committee or the Bathhouse Subcommittee as it was constituted.
Let me make you, well, all of us really, let me emphasize again, and I think Brad Johnson of our Washington office, who thought up this line, put his finger on it when he said, at the moment, education is our only vaccine. It's a nice line. I want to emphasize it. We're doing this, and it's important. I think that we should. But in the end, the thing that will make the difference is not a regulation that closes down on any activity. Because until the people decide that an activity is dangerous to them, they'll continue to do all sorts of things, no matter what laws you make. Nobody knows that better than Julio Martinez. I mean, you take children in classrooms, you show them pictures of people who arrive dead at a morgue somewhere because they've overdosed. You show them the most horrible films about addiction, and they go out and stick needles in their arms. You make every law you can against it until you educate them to the point where they willingly refuse to do it. You know, there's no real hope. Now, we think this helps deter and it helps educate, and that's very important.
Maybe I'm just not catching on. Dr. Axelrod just said something else needs to be done. What?
About what?
About spread of AIDS, over and above what you have here. Are you going to tell us?
Wait, excuse me, over and above what you have where?
Whatever these 8 points are.
Forget the 8 points. Look at his letter. Did you see that?
No, I just listened to him, and he said
Well,
something else
excuse me,
needs to be
Mickey,
done.
his letter says very clearly, what has to be done.
Well,
Says we ought to.
But he just said something else needs to be done. Are we going to have these 8 points? Are we going to have some other points? What?
Mickey, his letter says we ought to have a regulation. That's an amendment to the sanitary code that proscribes this kind of activity. That's what he says has to be done.
Governor.
Excuse me. Yeah.
Now, wait a minute, then I am thick. I don't understand what you're talking about. What are we going to have? A
He's
regulation?
going to have if he gets the Public Health Council to do it, a regulation that says certain kinds of activity produce the possibility of semen to blood. That's very bad, we all agree. We will prohibit places that encourage, promote, support that kind of activity on an institutional scale. That's the regulation. What, my words are not good enough. He's going to find better ones today and go to the Public Health Council. But that's what he is recommending, that you have to do something more. The something more is prohibit that kind of activity. We know it's occurring. Look at it alternatively. We know it's occurring. Can you allow it to continue? Can you allow people to make money, invite people in, or even do it on a not-for-profit basis, and say, we encourage you to engage in the following activities which could kill you? Some court might say we don't have the power to stop it, and if so, so be it. But until that happens, I think we are obliged to make the effort to prevent that kind of activity. I think, frankly, any rational society would try.
Just to try once more on that point. These 8 points that the council suggested, condoms, et cetera, that's not what you're talking about?
No.
No. That's not enough.
So specifically,
Jeannie,
what are
you
you
have a
going
question,
to
Jeannie?
prohibit?
Yeah, I want to follow up with you. You said the
Go ahead.
8 points aren't enough, but they're not part of the regulation.
Well, because the regulation will prohibit the activity. Those 8 points do not prohibit the activity. I mean, it's very simple. I don't know what you're having difficulty with. He's talking about stopping the activity. The 8 points says you can do it if you dress it up as follows. You put this on, you do that, and we're saying that's not enough. Is that clear?
Okay.
There's a difference between prohibiting it and allowing it with some regulations. By the way, I just want to make sure we nail this down. Wait a second. Does that still leave you confused? Jean?
Yeah, it does, because I'm getting confused between what's not enough,
Well,
and if
look
it's
at
not
the
enough,
eight-
why it's
well,
not
let's
in the
do it this way.
regulation.
Let's do it this way. Look at the 8 points, or whatever they are. Do those 8 points prohibit the activity? And the answer is no. And Dr. Axelrod has said they're not enough. We have to prohibit the activity. We can't allow it with condoms. That's not enough protection. That's what he's saying. Now, the Public Health Council, Bishop Moore, for example, disagrees with Dr. Axelrod. Did you know that? I think that's what he said to me. We'll find out tomorrow. I think Bishop Moore probably would settle for the 8 points.
He would settle for the 8 points, but I think he also recognized the difficulties that those 8 points raise with respect to the actual proscription of dangerous activities.
But I think the difference, Mickey and Gene, is between the 8 points not prohibiting anything and Dr. Axelrod writing a regulation that says, look, even with those safeguards, we want to stop the activity. I mean, it's as simple as that.
How quickly can the Public Health Council adopt these guidelines, should they accept them? Could it be done tomorrow, for instance?
Yes.
And then if it was done tomorrow, how soon would they go into effect? Would it be immediate?
Immediate.
And then they carry the penalty of either a fine or a misdemeanor conviction, is that right?
It would carry a fine of $1,000, but the regulation could contain within it additional penalties. If it were if there were a willful violation, it then would fall into the criminal portions of the public health law, and it would be accompanied by a fine as well as and/or imprisonment.
And Governor, would you urge vigorous enforcement of these regulations should they be adopted?
Well,
Aggressive enforcement? As opposed to, say, a period of time in which they should be phased in, for instance, and an educational campaign conducted as you did with the seatbelt law.
well, there's a big difference.
I understand.
The big difference is not just the level of risk and danger, but the fact that this subject, thanks to your paper and the Daily News and the Times and the Village Voice and the television and radio, this subject's been discussed over and over and over again. You don't have to give anybody any warning. I mean, Mickey knows the number. Marcia knows the bars. I mean, this is well known to everybody. No, I don't want to be facetious about it. The fact is, you're not going to catch anybody by surprise here. You know, nobody's been lulled into a false sense of security. I get all sorts of communications from people. And if Dr. Axelrod is right, and I believe that he is totally right, you're talking about a danger to people's lives and to the whole society. Of course we should move on that as swiftly as possible. And I'll tell you, I can't make the rules for the judges who are involved. What good is a fine of $1,000? I mean, what good is a fine to tell the guy, all right, I'll pay the $1,000? I mean, he could probably make that back between that event and the next time you catch him and have him in court. So I'd much prefer that they moved vigorously and closed them down, but I wouldn't have that power, you know, except to suggest it generally to judges.
Governor, under these regulations, then, is the idea that any establishment, no matter what it calls itself, that promotes or encourages sexual intercourse would be, could not
call it
operate,
sexual
or what?
intercourse, no.
Or what would you call it?
I wouldn't. I would leave that to Axelrod. That's why he's writing the language.
I mean, but it seems as that...
It's not just sexual intercourse, David.
Yeah. But it seems that these could the bathhouses operate under these regulations? I mean,
What are they doing now, these bathhouses? It depends on what they're doing now. If they have places that say, come in here, au natural bathhouse, you know.
assuming they're for sex and not for baths.
Well, and then what's your question?
Would they have to close down under these regulations then?
What, you mean those 8 to 10 places that are presumably, and I don't know, now just places where you go for promiscuous, anonymous, aggressive sex? Would they have to close down? Yeah, if you banned promiscuous, anonymous, aggressive sex. Unless they want to do something else, like have baths.
Governor, I don't see anyone here from the city. It seems to me that from what Dr. Axelrod said, the city is responsible for enforcing this thing. Why is that? I mean, are they involved in this or what?
David?
Yes, we've had extensive discussions with the city. I've spoken with Dr. Sensor. Jerry Crotty has spoken with the deputy mayor. I've spoken with others within the city in the course of discussing language for the proposed resolution. We, of course, will be consulting as well with the counsel to the New York City Department of Health. Dr. Sensor has indicated certainly a desire to have some kind of regulation that would deal with the problem of high-risk sexual activity, and we are working very, very closely together. The question of how the enforcement would take place is also an issue that we have been discussing. The nature of the inspections that might be required to take place. Those are obviously questions that need to be addressed and are part of the ongoing discussions with the city. We have been in close contact with the city, have had their full cooperation, and we obviously will continue to do so over the next 24 hours.
I think Hank, excuse me, Adam, I think Hank spoke to the city this morning. They're fully, where are they?
With the mayor, and we informed the mayor where we were as of this morning, and the continued discussions between Dr. Axelrod and Dr. Sensor.
David, they didn't object.
There has been no objection. I did read some proposed findings to the deputy mayor, who felt that that certainly was consistent with the concerns of the city. I did not read any proposed regulation to him, but we are, again, as I've said, continuing to work with them in drafting any language that would be proposed to the Public Health Council.
Dr. Sensor's not a member of the council?
No, he is not.
Would he be allowed to participate at the council?
No. The council does not permit the participation of anyone but members of the council itself.
Could heterosexual sex constitute a semen-to-blood contact?
Yes.
Doesn't that create potentially an enormous problem now for you then in terms of enforcement?
It creates a problem. I'm not sure that it's enormous. I think that the governor has emphasized again the need for education. The problem here is that we have a major public health issue, and I think that everyone who engages in promiscuous sex, whether it be heterosexual or homosexual, must recognize that he is placing himself at risk, and it is that risk that we are attempting to deal with.
Let me make sure I understand it. It's not the, for want of a better word, traditional heterosexual sex that presents the problem.
That's correct. Certain high-risk behaviors.
Yes, that is different than the traditional heterosexual sex.
Could you be specific, though?
No, it's in the questions and
I don't
answers. It's in the questions and answers. You can quote it right out of the questions
Well,
and
with a
answers.
flea bag hotel, for instance, that may be catering to
I think
clients of
I
prostitutes.
think the answer is, Fred, you better wait for the Public Health Council to pass on this. If they adopt a regulation, they'll have to explain it. And I'm content to wait until it's done. Why should we speculate as to what they may find tomorrow? Let them decide. They may, Dr. Axelrod may go in with language. Oh, I'm sorry, Fred. Oh, no, that's all right. Go right ahead. I don't want you to miss your deadline. Yeah, go ahead. It's good. Sure. Well, wait till you hear what we say when you leave. I'm finished. Good. Huh, Adam?
Will you guys be using undercover agents to infiltrate the baths and the bars to,
Why, you bored?
I want a job. Right, I'm worried. I want a job. Can I assume this will be a part of the enforcement effort?
I think you've extended beyond the nature of the discussions that we've had about enforcement.
Undercover, yeah.
When is the Public Health Council meeting? And are they the only body that can, authorize this regulation?
The Public Health Council meets monthly. It meets tomorrow at the Blue Cross Blue Shield in New York City. There is a meeting room which is provided to us by Blue Cross Blue Shield. It meets at 10 a.m. And it is at that meeting that I will be proposing the regulation to the Public Health Council. Is the Public Health Council the only body? It is the only body which has the authority under Section 225 of the Public Health Law to amend the state sanitary code, which has applicability to all areas of the state of New York.
Incidentally, you ought to know that the mayor sent a letter on insurance last night at 7:30. Have you heard the response to that? David, what is your response to the mayor's letter?
The mayor was concerned about the reimbursement system for AIDS patients, since there is a higher cost associated with the care of AIDS patients than there is for the general population. We have been in discussion with providers of health care for a number of months to come up with an adjustment to the existing payment system to fully cover the costs associated with the care of AIDS patients.
So the mayor is right, you need some kind of adjustment, and you're working on making the
It's
adjustment.
underway, and it will be retroactive, in fact, to the entire 1984 and 85 rate years with respect to case mix based on intensity of services required by AIDS patients.
Chip.
Another high-risk area of the population are drug addicts. I was wondering, did you contemplate, this? I think this has been raised by some people, contemplate the possibility of perhaps providing sterile syringes in high-incident areas?
The Q&A deals with the needles, and would we make available safe needles, clean needles? And the answer is, Dr. Axelrod's answer written out, please rely on that language. But he says, in effect, he's not persuaded that's a good idea. The state is not persuaded it's a good idea. I feel probably more strongly than they do opposed to it at the moment. I am not for it. I said so yesterday. I've said so from the day it was suggested. And it would take a very strong case by Dr. Axelrod to convince me otherwise.
Another element of this thing, the Q&A says that casual contact, blah, blah, same house, so forth, you're not going to, what about schools? You skipped that one, and that's obviously a big issue at the moment.
My reading of the Q&As, and I've been through this with Dr. Axelrod, if you take all the answers to all the questions there, put aside the lawsuit. The lawsuit tells us it's unconstitutional or it's wrong, we have to do what the law says. But all the answers to all the questions there would indicate that a parent with a child should be less concerned than they were in the beginning. If you read all those questions and answers, you see that casual contact won't do it. You see that fighting won't do it. You see that the only thing that does it is blood to blood, semen to blood, and you could maybe construct a situation where a child throws up, and there are certain secretions in the body that would endanger you if you got too close. All right. But I think, Mickey, that most, and like everybody else, you know, we were concerned. You read all the questions and answers, I think you have to conclude that the present system, which is a doctor with parents and experts saying this child is not a risk to everybody else, that's working reasonably well. All of this subject to what Judge Hyman says in the lawsuit. I'm not about to presume on him. If he comes down with a ruling and says it's unconstitutional, let them into a classroom, we'll have to deal with the law as he states it. But I think the import of the questions and answers is the present situation, an ad hoc judgment by experts objectively with parental involvement on the panel at least, that's an intelligent way to do it. David, is that?
Yes, that's correct.
Governor, I'm not quite clear on how much money you're going to put into this education.
You're not clear for a good reason. I didn't say how much.
And also, what ways are you going to attempt to educate people about AIDS?
Oh, well, the education program that Marty Stedman's put together includes everything. I mean, we're going to send David and all these people and people like Bishop Moore, going to send them out with the Q&A to radio shows, television shows, wherever you give us a forum, we will disseminate this information. Every way you can think of. We're not planning to buy television time, but if somebody out there, would donate money for television time, that would be sensational. Give us, so we haven't included that, but every other way you can do it, writing to weeklies, giving speeches, going on radio shows. I'm going from here to the broadcasters to give a speech to the broadcasters and frankly to plead with them to take this material and run it for us free, and they will. They will. They've been very good. The media generally has been good on this subject. Let me add that. We put this together because we thought it was necessary. I must tell you, the magazines, the newspapers that I've read have been terrific. I mean, they're not as complete maybe as this, but I haven't read anything that sounded irresponsible or like bad information. David?
Yes, I think that's very true. The need for the education is probably best emphasized by the experience of the American Red Cross, which did a poll to determine whether or not the donors were concerned about the transmission of AIDS. This was done several months ago. Despite all of the stories that have occurred, 43% of potential donors indicated that they thought they could get AIDS by the donation of blood. Now, there is no possible way that you could get AIDS by the donation of blood. Those are new needles, and they're very carefully constructed. The whole process does not allow for the introduction of any foreign material, and yet 43% of potential donors felt that they could get AIDS by the donation of blood.
You know, what I got from lay people over and over, and I talk about this a lot, parents saying, you're trying to tell me that this AIDS thing, which we don't understand and which could kill you, that's not as dangerous as a cold. Because, see, the cold you can catch by just being in the environment. You put your kid next to a kid who has a fever or a cold, you catch it. And what we're trying to explain to them is, yes, from that point of view, AIDS is a lot more difficult to get because you can't get it from the environment. You can't get it the way you catch a cold, which comes out into the atmosphere and you just take it in through whatever takes things in the body and it becomes part of you. You don't get AIDS that way. And now that people don't understand that, and they should. There are a lot of parents, I spoke to them in Queens, who said, Mario, some of them are friends of mine, I want to put my kid in a room, the same room with the AIDS kid, because they were thinking of colds and fevers and atmospherics and breathing it in and getting contaminated that way. It doesn't happen that way. Now, you have to explain that to these people or they'll be anguished unnecessarily. The education is the thing. Yeah, Mick?
Just one more thing on
this. Go ahead. No, ask. Go ahead.
I'm sorry, no, on this regulation, how close are you to the language on the regulation, Doctor? In other words, do you have something that you're holding up to give to them tomorrow, or are you still drafting?
We're still drafting for the 47th time.
Would any of it be available to us sometime today?
I would doubt that very seriously.
The
Given
answer is no.
experience.
The answer is no.
Given the experience so far, the answer would be no.
Incidentally, we sent unnamed aide on a vacation, so he won't be around.
Basically, Governor, then any establishment that offers some sort of sexual activity and that profits from that, no. I'm trying to
David.
figure out how to...
No, David, you're trying to figure out what I would be trying to figure out if I were you. How do I say this in the story? And it's not that easy. Say, Governor said, tomorrow we'll get the language. That's saying the story. The language is coming tomorrow. We're going to do another story for the Saturday morning.
But I mean, it sounds like any place that offers itself as a...
That's until you see the language. When you see the language, it may sound differently.
That offers itself...
No, I
sex.
reject that definition.
But yet you said the bathhouses couldn't continue to operate as...
I reject your definition. I find it to be inaccurate.
Okay.
Thanks. Okay.
Thank you, Governor.
Good job.